the supplement that is poisoning without anyone noticing. If you are over 65, there may be something inside your house, stored in the bathroom cabinet or on the kitchen shelf, that is slowly overloading your heart, and you have no idea. It's not a dangerous medicine nor an industrialized food. It's something you probably take every day believing you're doing good. A vitamin. Yes, a simple vitamin. The same one you saw being recommended on television, in advertisements, in WhatsApp groups, and even in medical consultations. But what almost no one told you is that, in the body of someone who is over 65, an excess of this substance can act as a silent poison. My name is Dr. Richard Hale, a cardiologist graduated from Harvard, and what I am going to explain to you now is something that I have been observing in offices, exams, and autopsies for over 2 decades. Excess vitamins, especially vitamin D combined with calcium, may be accelerating the death of millions of heart cells every day, slowly, without clear symptoms, without pain and without warning. And the scariest thing is that this is happening precisely with the people who try to take care of themselves the most. In recent years, the pharmaceutical industry has transformed vitamins into a daily consumption product. They stopped being medicines and became wellness habits. And so, millions of elderly people started taking capsules of vitamin D, C, zinc, calcium, and multivitamins as if they were harmless. But the human body, especially the aging body, does not deal with excesses in the same way that it deals with deficiencies. And the line between helping and overloading is thinner than it seems. To understand the problem, you need to imagine your heart as a machine made of muscles, electrical wires, and passage tubes, the arteries. Now imagine starting to deposit calcium inside these tubes, day after day, in tiny, almost imperceptible doses. For months, nothing happens. But little by little, these deposits accumulate, harden the walls of the arteries, and transform what was once flexible into something rigid. It is the beginning of a process called vascular calcification, and this process is fueled, ironically, by a vitamin that should protect you, vitamin D. This vitamin, when used in the right dose, is a powerful ally. It strengthens bones, improves immunity, and helps in calcium absorption. But when consumed in excess, without medical supervision, it transforms calcium into an enemy. Instead of going to the bones, calcium starts to deposit in blood vessels, kidneys, and even heart valves. Over time, blood circulates with more difficulty. The heart works harder to overcome resistance, and blood pressure starts to rise. It's the kind of damage that doesn't hurt until the day the body can't take it anymore. Most people believe that the body eliminates excess vitamins naturally. But this is only true for water-soluble vitamins, such as vitamin C and B complex vitamins. They come out through urine. Fat-soluble vitamins, such as A, D, E, and K, are different. They accumulate in the liver, fats, and tissues. And when the body ages, the metabolism of these vitamins becomes slower, causing each ingested capsule to remain active for much longer than expected. This is how the excess begins, discreetly, but cumulatively. In my older patients, it is common to hear phrases like, "Doctor, I take my vitamin D every day without fail." And it is precisely this "without fail" that is frightening, because the body doesn't need it every day. Vitamin D is stored for weeks, and when the body is already full, each new dose is like one more drop of calcification inside the arteries. What worries me most is that the problem does not appear in routine exams. Calcium in the blood may even seem normal, but inside the walls of the vessels it is already accumulating. The first signs are usually mild: an inexplicable tiredness, palpitations when climbing stairs, a discrete stiffness in the legs, a blood pressure that rises for no reason. And while the elderly person believes they are getting stronger by taking their vitamins, the heart is slowly hardening from the inside. In the next few minutes, I will show you how this belief in the more, the better has become one of the biggest traps of modern medicine, and how, for those over 65, this common vitamin may be corroding the heart invisibly. But before continuing, tell me here in the comments, which vitamin do you usually take every day? Also, tell me your age and the city where you are watching me from. This information helps me understand how many people are running this risk without knowing it. And maybe, just maybe, this video can save someone from the next unnecessary dose. How the elderly were deceived by the myth of the miracle vitamin. The story behind vitamin D is almost a portrait of the modern era, a real scientific idea, distorted by marketing and pushed as a promise of longevity. It all started with good intentions. Decades ago, doctors and researchers discovered that low levels of vitamin D were linked to fragile bones, low immunity, and a higher risk of chronic diseases. It was true, but what happened next was the same as what happens whenever the industry sees an opportunity. Science became a product. Suddenly, vitamin D went from an essential substance to a kind of universal cure. In TV commercials, health magazines, and talk shows, headlines began to appear such as, "Vitamin D, the hormone of life. Those who take vitamin D live longer and get sick less. Elderly people should supplement every day." And so, the fear of deficiency turned into dependence. Millions of people started consuming daily capsules without medical supervision, believing that, because it is natural, there would be no risk. But in the human body, everything that is natural has a limit. Even sunlight, if in excess, burns. And vitamin D, which is precisely the sun vitamin, is no exception to this rule. The mistake was twofold. First, because most people do not need daily supplementation. Just 15 to 20 minutes of sun per day, with small areas of skin exposed, for the body to produce the ideal dose of vitamin D naturally. Second, because the aging body does not process vitamin D in the same way. The liver and kidneys, responsible for converting vitamin D into its active form, already work more slowly after 60. So, when the elderly person ingests daily capsules, the body accumulates the substance without being able to eliminate it at the same speed. It is a silent accumulation, which becomes dangerous over the months. But the inconvenient truth is that the supplement industry profits precisely from fear. And nothing sells more than the fear of fragility. Advertisements exploit the insecurity of the elderly with phrases such as "strengthen your bones," "protect your heart," "boost your immunity." And wrapped in this emotional discourse, the elderly person buys not a supplement, but a promise of security. A false promise, because strength and immunity do not come from isolated capsules, but from internal balance. Another problem is that many doctors, pressured by fads and simplified protocols, started recommending vitamin D as mandatory in old age, without assessing clinical history, kidney function, or other supplements used. Thus, what started as care became routine. The elderly patient takes the pill every day, often in conjunction with calcium and multivitamins, creating a dangerous combination. This mixture, over time, causes calcium to start depositing where it shouldn't, in the arteries, kidneys, and heart valves. The worst thing is that most people feel the immediate positive effect: more energy, better mood, even less pain. And this creates a feeling of, "it works," as if the body were asking for more. But it is a biochemical illusion. Vitamin D really improves calcium in the blood and temporarily increases muscle strength. But what no one explains is the price the body pays for this quick gain. Over time, excess calcium hardens the vessels, makes the blood denser, and overloads the heart. It's like building a stone wall inside the arteries. Each pill adds a new brick. This is the cruelest face of the myth. It offers immediate well-being and slow destruction. It's as if the vitamin itself had two personalities, the healer and the murderer. And the difference between them is only in the dose and the context. While a small amount can protect, excess initiates a process of silent self-intoxication. In the last 10 years, studies from the University of Boston, Harvard, and Oxford have been warning about the risks of hypervitaminosis D, the medical term for excess of this vitamin. But these warnings rarely reach the public because they don't sell. Saying that too much vitamin kills is not as profitable as saying vitamin saves. And that is why so many elderly people continue taking daily capsules without knowing that they are feeding the same enemy they think they are fighting. Science is clear. The human body needs vitamin D, but in balance. Absence causes weakness, and excess causes rigidity, including in the arteries. And what kills the elderly's heart faster is not the lack of movement, but the loss of flexibility of the vessels. Without elasticity, the blood loses its rhythm. The heart becomes exhausted, and life becomes shorter, centimeter by centimeter of calcified artery. In the next few minutes, I will show you exactly how this excess turns into poison inside the body. You will understand what happens step by step and why the body after 65 can no longer eliminate what it receives in excess. It is at this point that the remedy becomes the problem. When excess becomes poison, every substance that helps the body can also destroy it, just exceed the limit. The difference between medicine and poison is only the dose and the time. And with vitamin D, this limit is much narrower than most imagine. Behind the fame of miracle vitamin, there is a little talked truth. When it is consumed in excess, the body begins to slowly intoxicate itself from the inside out, transforming a protector of the bones into an enemy of the heart. Vitamin D has a noble function. It helps the body absorb calcium and phosphorus, two minerals fundamental for bone strength. But the body is a precise machine. It needs these minerals to reach only where they are needed. When there is balance, calcium goes to the skeleton, fixes to the bones, and strengthens the body structure. But when there is excess vitamin D, the body is forced to absorb more calcium than it should, and what it cannot use, it needs to store. How? Depositing this calcium in the arteries, kidneys, and heart valves. This is where the medicine turns into poison. This condition is called hypercalcemia, and it is one of the most dangerous consequences of exaggerated supplementation of vitamin D. In simple terms, it means that there is too much calcium circulating in the blood, and calcium, out of place, is a toxic substance. It interferes with the electrical communication of the heart, hardens the walls of the vessels, and impairs blood flow. What was once an elastic and dynamic system becomes a network of rigid and fragile tubes. To understand the gravity, imagine a garden hose. When it is new, it is flexible, the water flow is constant and smooth. But with time and exposure to the sun, it hardens and cracks. The same happens with the arteries. The calcification caused by excess vitamin D makes the blood circulate under more pressure, as if the hose were narrow and dry. The heart, noticing the resistance, increases the force of the beats to push the blood. And each stronger beat represents a new microtrauma in the vessels, one more step towards hypertension and heart failure. The most treacherous thing about this process is that it happens in silence. For months, sometimes years, there is no pain, no fever, no obvious sign. The body only adapts, supporting the excess until the limit. And while the elderly person believes they are strengthening, calcium is slowly accumulating, like liquid cement, inside the arteries. Until one day the heart gets tired. A simple effort, a quick walk, and it can no longer keep up. The air is lacking, the pressure rises, the chest weighs, and only then the danger is revealed. But why does this happen so often? Because the body after 60 does not eliminate the excess efficiently. The kidneys, which should filter excess calcium, work more slowly. The circulation is slower, the hepatic metabolism is reduced, and the ability to regulate minerals decreases. That is, the same dose that is safe for a young adult can be toxic for an elderly person. And unfortunately, most people continue taking standardized doses, 2,000, 5,000, sometimes even 10,000 IU, without understanding that this is the equivalent of filling a glass that is already overflowing. In addition, there is another little commented factor. Vitamin D is fat-soluble. This means that it accumulates in body fat and in the liver, remaining active for weeks. Unlike vitamin C, which the body eliminates in hours, vitamin D stays there, waiting for the next dose. When these doses add up, the body enters a state of saturation, and the excess begins to act as a silent toxin. It is not an acute intoxication. It is something much more dangerous, a chronic and cumulative intoxication. The first effects are subtle: a constant thirst, easy tiredness, blood pressure that rises for no reason, a feeling of internal heat. These are signs that the body is struggling to maintain chemical balance. But when the calcification is already advanced, the risk becomes real. Arrhythmias, arterial stiffness, kidney failure, and increased risk of heart attack and stroke. And all this starts with the belief that vitamin never hurts. In the offices, I see elderly people daily with apparently normal exams, but with typical symptoms of calcium overload. When we investigate, the pattern repeats itself. constant supplementation of vitamin D, often combined with calcium and other multivitamins. It is the dangerous trio: vitamin D, calcium, and misinformation. Of course, vitamin D is essential, but the body needs balance, not exaggeration. What saves one person is the same thing that can destroy another, depending on the dose and the context. And for those over 65, this context changes completely. In the next few minutes, I will show you what exactly happens inside the body when this excess starts to act, step by step, from absorption to calcification of the arteries. You will understand why what seemed like strength is, in fact, a slow process of hardening the heart. What happens inside your body, step by step? It all starts with a capsule, an innocent, almost automatic gesture. You wake up, drink water, and swallow your vitamin D believing you are protecting the body. But within a few minutes, a silent sequence of chemical reactions begins to unfold. It is a process that, in small doses, helps the body, but in excess, completely reprograms the natural balance between the bones, the blood, and the heart. Vitamin D, when entering the body, is absorbed in the intestine with the help of dietary fats. It goes to the liver, where it transforms into calcidiol, its first active form. Then, in the kidneys, this calcidiol turns into calcitriol, the hormonal form. And it is at this point that the problem begins. Calcitriol sends a clear order to the intestine: absorb more calcium. It does this even when the body already has enough calcium. The intestine, obedient, begins to pull the mineral from food in an exaggerated way, and the blood, which should have a controlled amount of calcium, starts to circulate with levels much higher than normal. This excess of calcium is not immediately dangerous, at least not at first glance. But inside the blood, it starts looking for a place to fix. When the bones are already saturated, the body begins to deposit the surplus where it shouldn't, in the walls of the arteries. It is as if small particles of limestone accumulated slowly along the blood vessels, hardening what should be flexible. This process is known as arterial calcification, and it is the true villain that transforms an essential vitamin into an agent of accelerated cardiovascular aging. While this happens, the heart tries to adapt. It needs to push the blood with more force, because the arteries, now hardened, lose the ability to expand and contract. Each beat becomes more costly, and the more the heart works, the more it wears out. What was once an elastic and efficient muscle is transforming into a fatigued organ, which struggles every day to overcome the resistance created by an excess that started with good intentions. The most dangerous thing is that this rigidity does not appear in common exams. Serum calcium tests usually show normal levels because the calcium that is circulating in the blood is not the problem. The danger is in the calcium that has infiltrated the arterial walls. It is an enemy that hides inside the vessels, visible only in specific exams, such as the coronary calcium score tomography, a test that almost no one does until it is too late. As time passes, this accumulated calcium begins to cause microlesions in the arteries. The blood, when flowing, scrapes on the hardened edges and causes small inflammations. The body, trying to repair these lesions, releases platelets and fibrin, creating microclots. These clots further reduce the space for blood flow, increasing blood pressure and the risk of blockage. It is a vicious circle. Excess vitamin D increases calcium. Calcium hardens the arteries, and the body responds with inflammation, which further accelerates rigidity. Another serious effect occurs in the electrical system of the heart. Calcium is an essential mineral for the heartbeat. It is the one that regulates the electrical impulses between the cells. But when there is too much calcium, the signals get confused. The heart starts beating out of rhythm, causing arrhythmias. These electrical changes, which seem harmless at the beginning, can evolve into serious irregular beats, a feeling of mismatch, and even atrial fibrillation, one of the main risk factors for stroke in the elderly. And the kidneys also pay dearly for this. The excess of calcium needs to be eliminated, and the kidneys are forced to filter more than they can. Over time, the renal tubules become inflamed and begin to retain even more calcium, forming microcrystals that can evolve into kidney stones and renal failure. That is, the same supplement that promised to protect your bones ends up harming the two most vital organs for longevity, the heart, and the kidneys. This process is so slow that many people confuse the symptoms with normal aging. A persistent tiredness, a blood pressure that oscillates, a feeling of tightness in the chest, a stiffness in the shoulders or legs. Everything seems part of the age, but in reality, it is the body being suffocated by its own excess. Each pill taken without control is a small layer of calcification more, an invisible step towards the total rigidity of the arteries. The good news is that the body tries to warn. It gives signs, discreet but clear, that something is wrong. And those who learn to recognize them can prevent the process from advancing. In the next few minutes, I will show you why the risk is even greater after 65, when the body loses the natural ability to eliminate this excess. You will understand why, from this age, even a normal dose can turn into a slow bomb inside the organism. Why this is even more dangerous after 65. After 65, the body enters a completely new biological territory. The processes that previously worked with millimeter precision, filtering, metabolizing, hormonal balance, start to operate more slowly, like old gears that still turn, but need more time and care. And it is in this scenario that excessive supplementation of vitamin D turns into a deadly trap. The first organ to suffer is the kidney. It is the main filter of the body, responsible for eliminating the excess of calcium, phosphorus, and residues of vitamin D. But with aging, the glomerular filtration rate, the volume of blood that the kidneys can clean per minute, can fall up to 40%. This means that the calcium that was previously easily eliminated now remains circulating in the blood for much longer. The body, to protect itself, begins to deposit this calcium in the soft tissues and in the walls of the arteries. It is the beginning of a mineralization process that literally transforms parts of the body into stone. At the same time, the liver, responsible for converting vitamin D into its active form, also loses efficiency. With age, the liver accumulates fat, loses part of the enzymes, and metabolizes substances more slowly. So, when the elderly person takes a high dose of vitamin D, the liver continues releasing small amounts of the active substance for days, sometimes weeks. What should be a controlled peak becomes a continuous exposure. And each new capsule ingested adds to the previous one, creating a state of silent saturation. The third factor is the natural hormonal decline. With advancing age, the body produces less estrogen and testosterone, hormones that, among other functions, help regulate the use of calcium in the bones. Without this regulation, the body begins to err the destination of the mineral. Instead of directing it to the skeleton, it sends it to the bloodstream. And it is exactly there that the excess of vitamin D aggravates the error, pushing even more calcium to where it shouldn't be. The result is a double loss: bones that remain fragile and arteries that become increasingly hard. In addition, there is a crucial change in the structure of the blood vessels. Over time, the cells of the endothelium, the inner layer that lines the arteries, lose the ability to produce nitric oxide, the substance that keeps the vessels flexible and relaxed. Without nitric oxide, the vessels become rigid, and any increase in calcium accelerates the hardening. What was a living and elastic artery transforms into a kind of glass tube, unable to adapt to the pressure of the blood. And the heart, like a pump that needs to overcome an increasingly hard wall, begins to wear out. This progressive wear is what leads to silent heart failure, common in apparently healthy elderly people. Another little commented factor is the loss of sensitivity of the cellular receptors. With aging, the cells that use vitamin D, present in bones, muscles, and immunity, become less responsive. This means that the body needs less vitamin to function well. But, without knowing this, many continue taking the same doses recommended for people of 30 or 40 years. The result is predictable. The body, unable to use everything it receives, accumulates the surplus, and the surplus becomes toxin. And there is also the role of chronic dehydration, one of the most common conditions after 65. With age, the body feels less thirsty and tends to drink little water. But without enough water, the kidneys cannot eliminate the excess calcium. This increases the mineral concentration in the blood and creates the perfect environment for the formation of crystals, invisible microstones that lodge in the arteries and kidneys, initiating the calcification process. With each passing day, the blood becomes denser, the heart more tired, and the pressure more unstable. These factors together, slow metabolism, reduced renal filtration, hardened vessels and dehydration, create the ideal scenario for what doctors call cumulative toxicity. It is not a punctual error. It is the result of daily repetitions. The aging body does not err at once. It errs little by little. And the danger of vitamin D is precisely there. The elderly person believes they are taking care of themselves, while the body, in silence, is trying to deal with the excess. That is why the same supplement that saves one person can sicken another. What determines the effect is not the substance. It is the terrain in which it falls. And after 65, the terrain of the human body changes completely. It becomes more delicate, slower, and less tolerant to accumulation. And when we ignore this biological reality, we give the body more than it can process. In the next few minutes, I will show you what are the first signs of this intoxication, the warnings that the body sends before the problem becomes serious. If you learn to recognize them in time, you can literally save your heart before the excess continues to accumulate. The first signs of vitamin D intoxication. Vitamin D intoxication does not start with an obvious symptom. It does not cause fever, nor pain, nor extreme tiredness right from the start. It starts with subtle changes, signs that seem banal, but are the body trying to scream through the silence. They are symptoms that are confused with common aging, but that in reality are the reflection of a heart and a circulatory system overloaded by excess calcium. The first and most common is constant thirst. Many elderly people report that the dry mouth never passes, even drinking water. This happens because the body, trying to balance the elevated calcium in the blood, stimulates the kidneys to eliminate more liquid. The result is a progressive dehydration. But, as the kidney is already functioning slowly, this attempt to clean becomes inefficient. The person feels thirsty, but the blood remains dense, a paradox that indicates hypercalcemia in progress. Another frequent sign is blood pressure that rises without warning. It no longer depends on salt, stress, or food. It is the calcium inside the arteries altering the tone of the vessels. When calcium accumulates in the arterial walls, they lose the ability to relax. This means that, even at rest, the blood flows under pressure. The heart is forced to beat harder, and each beat becomes a small extra effort. Little by little, the body adapts, but the pressure becomes chronically high, and the elderly person believes that it is only family inheritance, when, in reality, it is masked intoxication. The third symptom is tiredness without explanation, a type of fatigue that does not improve with sleep. This happens because the heart and kidneys are working double, trying to compensate for the resistance of the vessels and the thickness of the blood. The body starts to divert energy to maintain stable circulation, and the result is a constant exhaustion, even in simple activities such as walking or talking. Many confuse this tiredness with lack of vitamin and end up taking even more supplements, feeding the cycle of excess. Intestinal constipation is also an important sign. When the blood has high levels of calcium, the intestine loses water and the muscle contractions become slower. The feces become dry and hard, and the body takes longer to eliminate them. This symptom, apparently harmless, is a classic marker of hypercalcemia. And the most curious thing is that many people treat constipation with laxatives, without realizing that they are only masking a much deeper problem. Another symptom that deserves attention is the accelerated or irregular heartbeat. Calcium is the main responsible for the electrical conduction of the heart. When there is too much, the impulses between the heart cells get confused. The heart starts beating out of rhythm, sometimes faster, sometimes weaker. It is what we call arrhythmia by hypercalcemia. At the beginning, it comes in brief episodes, like mild palpitations, but over time, it can become dangerous, opening the way for atrial fibrillation and heart failure. There is also tingling in the extremities, especially in the hands, feet, and face. This symptom is the result of the alteration of the nerve impulses caused by the excess calcium. It changes the polarity of the nerve cells, leaving them hyperactive. It is an early sign, which the body uses as a discreet alert that something is out of mineral balance. Ignoring it is like ignoring the first noise of an engine that starts to fail. Some patients also report a diffuse malaise, a feeling of weight in the body, or of internal pressure. This discomfort comes from the continuous effort of the heart and the lack of adequate oxygenation in the tissues. The blood, more viscous, takes longer to deliver oxygen. The brain responds with mild mental confusion, memory lapses, and difficulty concentrating. The person feels that they are slower, more forgetful, with a heavy head. But the real problem is not in the brain, it is in the blood that feeds it. Another silent symptom is the decrease in urine. As the kidney tries to protect itself from the calcium overload, it reduces the filtration. The body retains liquid, and the urine becomes darker, more concentrated, and with a strong odor. This is a direct sign that the kidneys are suffering, and that the intoxication is already affecting the excretory system. In some cases, kidney stones or discrete low back pain appear, which comes and goes, but which already indicates that the calcium has begun to crystallize. These symptoms do not appear all at once. They manifest in sequence, like chapters of a story that the body tries to tell. First comes the thirst, then the tiredness, the constipation, the pressure that oscillates, the heart that accelerates. It is a clear physiological narrative for those who know how to listen. And if you recognize 2 or more of these signs in your routine, do not ignore them. The body is asking you to stop, not only taking the vitamin, but continuing to treat health as a list of pills. The saddest thing is that many of these patients only discover the intoxication when it has already affected the heart. The calcification of the arteries is, in large part, irreversible, but it is possible to interrupt the advance, and, in some cases, reverse part of the damage. Everything depends on a simple decision. Understand what is happening and correct it now. In the next few minutes, I will show you the most common mistake that multiplies the risk of calcification and accelerates the aging of the heart: the combination of vitamin D with calcium. It is this mixture that transforms what would be a supplement into a poison. The most common mistake: combining calcium and vitamin D. In almost every home I visit, I find the same pattern: a box of vitamin D and next to it, a bottle of calcium. Often bought together, taken together, and, unfortunately, accumulating together inside the body. This is, without a doubt, the most common and most dangerous mistake committed by people over 60 years old. The intention is good: strengthen the bones and prevent osteoporosis. But what most do not know is that this combination accelerates arterial stiffness, increases blood pressure, and ages the heart from the inside. Let's understand why. Vitamin D has the function of increasing the absorption of calcium in the intestine. It causes almost all the calcium ingested to be pulled into the bloodstream. This is great when the body really needs the mineral, as in cases of deficiency or diagnosed osteoporosis. But when the organism already has normal levels, the result is an excess that has nowhere to go. And it is exactly at this moment that calcium, instead of going to the bones, migrates to the vessels. The human body does not have a perfect mechanism to expel excess calcium. It tries to store what it cannot use, and does this by depositing the mineral in the soft tissues. These deposits begin in the small arteries and capillaries, expanding slowly until reaching the large arteries, especially the aorta and the coronary arteries. It is as if the body were trying to save the calcium in a safe, without realizing that it is clogging its own circulation system. When vitamin D and calcium are taken together, the process accelerates dramatically. Vitamin D acts as a gate opener, allowing calcium to enter the cells in large volume. But without the presence of another essential nutrient, vitamin K2, the body loses the ability to direct this calcium to the right place. The result is what we call ectopic calcification. Calcium goes where it shouldn't go. It accumulates in the arteries, hardens the heart valves, and even deposits in the walls of the lungs and kidneys. This combination error is so serious that in 2019, a study published in the Journal of the American Heart Association warned, the joint supplementation of vitamin D and calcium in the elderly increases the risk of cardiovascular events by up to 24%. This means that almost a quarter of the patients who take this combination every day are literally shortening their own lives in the name of health. The problem is not only the extra calcium, it is the calcium in the wrong place. In the bones, it is strength. In the arteries, it is rigidity. And the more rigid the arteries become, the more the heart suffers. With each beat, it needs to overcome a greater resistance. The blood flows with more pressure, the endothelium wears out, and microlesions form. These small lesions inflame, attract fat, platelets and fibrin, the beginning of the process of accelerated atherosclerosis. And what is more ironic, many elderly people do everything right, walk, eat well, sleep early, but continue taking calcium with vitamin D without knowing that they are canceling the benefits of a lifetime of care. To make matters worse, the food industry reinforces this error. Just turn on the television and you will see commercials saying, "Protect your bones with calcium and vitamin D." But they do not mention a word about previous exams, renal function, use of vitamin K2, or personalized dosage. Everything is sold as if it were universal, when, in medicine, nothing is universal. And the body after 65 is even more vulnerable to this combination. With reduced renal function, the elimination of calcium falls. With slower hepatic metabolism, vitamin D remains active for longer. With the common dehydration in old age, the blood becomes denser. That is, the terrain is perfect for calcium to crystallize inside the vessels. And each new dose is like adding more sand to the cement that is hardening the heart. That is why, in several countries, such as Japan and Germany, doctors only prescribe vitamin D accompanied by K2 and magnesium, precisely to prevent calcium from accumulating where it should not. These countries understood something simple. Vitamin D without K2 is like opening a door without knowing what is on the other side. The great deception is to believe that supplementation is equal to prevention. Preventing is understanding the balance, not piling up nutrients. The human body is a closed system, and everything that enters needs to have a destination. If it does not have one, it accumulates, and the accumulation is always the beginning of the problem. In the next few minutes, I will show you how it is possible to reverse this picture, how to clean the arteries, eliminate the excess, and restore the flexibility of the vessels in a natural, safe, and proven way. You will see that the body has the ability to regenerate, as long as we stop giving it what is killing it in silence. How to reverse the damage and clean the arteries. The good news is that the human body has an extraordinary capacity for regeneration. Even after years accumulating calcium in the arteries, it is possible to slow down, interrupt, and even reverse part of the process. There is no miracle. There is well-understood physiology. And when the body receives the right environment, it begins, little by little, to clean itself on its own. But for this to happen, it is necessary to stop insisting on the errors that sickened it and offer the nutrients that are missing to re-establish the balance. The first step is to interrupt the unnecessary supplementation. This does not mean abandoning vitamin D, but re-evaluating the dose and the context. No body needs something every day blindly. Vitamin D should be adjusted according to laboratory exams. The ideal is that the serum level is between 30 and 60 ng/ml. Below that, there is deficiency. Above that, there is risk. It seems simple, but it is exactly here that most ERR. They continue taking the same standard dose of 5,000 IU daily, even when the body is already saturated. In people over 65 years old, 2 to 3 weekly maintenance doses are more than enough, and always under medical supervision. The second step is to reintroduce the nutrient that balances vitamin D, vitamin K2. Few people know this name, but it is the true traffic of calcium. K2 acts as a guide. It takes the calcium that is loose in the blood and takes it back to the bones, preventing it from depositing in the arteries. Without it, calcium loses its destination and begins to accumulate where it shouldn't. Studies from the European Heart Journal show that elderly people who regularly consume K2 have up to 50% less arterial stiffness. It is found in fermented foods such as natto, Japanese fermented soybeans, cured cheeses, free-range egg yolk, and bovine liver. But, in practice, the modern diet rarely provides enough K2, which makes supplementation a useful tool, as long as it is adjusted by a doctor. The third pillar is magnesium. If K2 is the guide, magnesium is the brake. It regulates the absorption of calcium and prevents the mineral from depositing in excess. Without magnesium, vitamin D works alone, absorbing more calcium than the body needs. It is like a car without brakes going down a hill. Magnesium maintains the electrolyte balance, relaxes the arteries, and reduces blood pressure. Natural sources include avocado, almonds, pumpkin seeds, spinach, kale, and pure cocoa. In some cases, the supplement of citrate or glycinate of magnesium may be necessary, especially for those who suffer with cramps or nocturnal insomnia. The fourth step is to hydrate and detoxify the blood. The viscous blood needs fluidity. Water is the natural solvent that helps the kidneys eliminate the excess of calcium and metabolic residues, but most elderly people drink less than they should. The ideal is to divide the hydration throughout the day, a glass every hour before feeling thirsty. Adding a few drops of lemon or a minimum pinch of sea salt in one of the glasses helps to replenish electrolytes and improve cellular absorption. Without hydration, no protocol works, because calcium needs a way out. The fifth step